Back to our webinar series. Our webinar today will discuss family discussions and relationships when coping with a pediatric brain tumor. My name is Jillian Dimas, Senior Program Manager at the American Brain Tumor Association. I'm delighted to introduce our speaker today, Nancy Sincata. Ms. Sincata is the Psychosocial Director at Camp Sunshine in Casco, Maine. Camp Sunshine is a camp that supports children with life-threatening illnesses, including brain tumors, as well as their whole family. Nancy is also on faculty at Mount Sinai Hospital, where she has worked as an oncology social worker and supervisor for 25 years. Prior to that, she was a child life specialist. She is the author, and her research has focused on hope and the resilience of social workers. Thank you for joining us, Nancy. You may now begin your presentation.
Hi, everybody. It's great to have been invited to be here, and I look forward to speaking with all of you over this next hour, to families and professionals alike. I just want to let you know a little bit of my story. I've been working with families of children with brain tumors since I started as a peds oncology social worker, and I currently am employed at Camp Sunshine, and we are a retreat for families of kids with life-threatening illnesses. Camp Sunshine is, in fact, in Casco, Maine, and it is should be up on your screen now. There's some things that I think are relevant for you to know in a kind of discussion about where I'm coming from in working with families. Camp Sunshine is currently 29 years old. It'll be 30 years old tomorrow, and we serve about 800 families annually. And in the first 17 years of our program, from 1988 to 2002, families of children with brain tumors were included in all of the programming. But when we opened a facility, which now is a one-of-a-kind retreat center, and the only place we know kind of in the world where that is our sole purpose, is to bring families there in the retreat model, we began understanding families of children with brain tumors a little bit better, and it seemed that we actually needed to develop programming that was very specific to children of families with brain tumors. And what's just interesting for you to know that as we've grown over the years, that we currently serve about 537 families that are active with us in one way or another with our program. And we know families of kids with brain tumors who are on treatment and off treatment, and we also stay connected with families should their children die from a brain tumor. I think one of the things that's very interesting, when you're treated for brain tumor, you are often in an oncology clinic. Some people are in programs that are specific to brain tumors, but it's interesting to think about the ways in which the needs of families of kids with brain tumors are a little bit different than families of kids with oncology sessions. And the first time that we ran 8 sessions in the summer, oncology sessions back-to-back, I found myself thinking about parents of kids with brain tumors, because in the parent group model, where I run a parent group every day for the days that people are at camp, parents of kids with brain tumors were either more assertive, more aggressive, louder, and it was a pretty consistent theme. And I think that it made us sit back and look and realize that the journey is something that is so different for parents of kids with brain tumors. And I think now, why is the journey different? And I think that as you think about it, you realize that sometimes parents will be aware of symptoms that have kind of come with sudden onset, and it may take a little while to figure out what's going on. But when it becomes apparent that a child has a brain tumor, that there is kind of an illness trajectory that happens, and very often that trajectory is about kind of, if not just a biopsy quickly, emergency surgery quickly. And I think that one of the things that happens for families is that they are thrown into the medical world really quickly, generally emergently, and often with a surgery that may have many side effects as a result of surgery, at least even short-term side effects. So one of the things that happens is you're dealing with your healthy child who all of a sudden is having major brain surgery, and then may have to deal with kind of treatment, whatever that treatment is afterwards, which could be chemotherapy, radiotherapy, more surgery. And so you are dealing with a child who is actually healing from major surgery and may not be quite themselves emotionally, intellectually, cognitively after that procedure, as opposed to kind of in other, certainly childhood cancer or childhood illness journeys where, in fact, you are dealing with the illness and then the treatment, but your child is effectively, emotionally, the same child that you've gone into the rest of life experiences with. So you're not just dealing with a child and an illness, you're also dealing with a child who's been through a major upheaval and who may, in fact, be not quite themselves at the beginning part. And so I think it's a lot for parents and families to have to deal with, and I think for everybody in the family there is, in fact, kind of uncharted territory that is ahead. And I think that some of you on the line will know what I mean by talking about uncharted territory, because, in fact, sometimes there is a roadmap of what people are going to do for this medical problem, and sometimes people have situations that are very rare, very complicated, tumors that are in difficult places to access, and it is not always the same journey. So when you say my child's brain tumor, it is not the same as an illness where there is a more clear path, and everybody's story, in a way, is not different. Sometimes in the brain tumor journey, there's also kind of a whole host of things that you encounter, meaning that you need like a special treatment, and that treatment is not in your hometown, and you need to travel in order to get that treatment or to find the expert who is managing that illness. So there's not only then, on top of, you're now in a situation where you have been thrown in. There's a lot of information you're trying to learn pretty quickly. Your child has maybe had emergent surgery, and you may, in fact, have to travel far from home in order to do that. So when you put all of those things together, it is really impressive that families with kids with brain tumors are as resilient and as strong as they are and do manage what they need to manage. So, in fact, it is a complicated journey, and it's a journey that probably does make parents more assertive and need to speak up more in the interest of their child. So one of the things that we did when we began developing programming for families of children with brain tumors, and let me just say what that is, that in fact we run multiple sessions a year just for families of kids with brain tumors, and we may have up to 40 families at a session, and a session is often 5 nights and 6 days. So one of the interesting things is kind of not just working with families of children with brain tumors, but it's actually living with families of children with brain tumors. So our goal was to really kind of create a community, and what we have found is that we've created a community and then subsets of that community within the community based on either a particular diagnosis or a particular issue that someone is facing. So certainly, I think we're all familiar with the concept that if you bring people in very similar situations together, you can really enable people to help each other. And what we have seen is a real explosion of kind of knowledge, support, alliances between families, and things that, I think that you know what is going to happen, but when you actually live it and feel it, there is a magic. And even magical is maybe not even a strong enough word to kind of see how both empowered families become and the encouragement that they bring to each other, and hope that I think is kind of created within connection to one another, and then the genuine concern that happens for families with each other, and then again the strength of that connection and how it carries people way beyond the days that they are at the retreat, and then to kind of really see the strong relationships that happen across various ages, between children and adults, and all people facing, again, maybe similar challenges, but challenges that they can help each other with. So think about kind of the relationship when your child is diagnosed. How do you talk to your child? What do you do with your child when they're diagnosed with a brain tumor? Does the world stop? Does everything change? Does everything have to change? And I think that one of the things that sometimes is hard to hold on to is that children are children and children first, and that all of the things that are important to them as children in the past remain important to them as in the present and in the future. And that when you think about ways of interacting, I mean, it sounds very, very simplistic to say, to focus on activities of childhood and joys of childhood. But I think after your child is diagnosed, you actually really benefit from somebody reminding you that it's important to kind of hold on to life and to hold on to the things that you and your family enjoy doing. So I think that one of the things that we talk a lot about both in medical centers and at camp is to kind of focus on the family and the whole family and think about kind of what family-centered care means and what family-focused activities are. So, you know, if you think about it, you're doing all of this very complicated medical stuff and you find yourself in very stressful situations. It's hard for it to not be stressful when your child is diagnosed with a brain tumor. And I think it is hard to, you know, kind of actually say to the outside world, we're going to stop everything and we're going to just focus on what our needs are as a family. And you think about it, you're hardly, I think, kind of getting through the days and getting through with all the tasks that you need to get through medically, taking care of the other children who are in the house, figuring out who's going to work, who has the medical insurance, what you're going to do. And you think about the impact is so great when it is a child who is diagnosed with brain tumor, because it's not one family member who is taken out of the family system, but in fact it is the entire family that is taken out of the life that they knew. And if you think about it, you think about as an adult, your child is diagnosed with brain tumor, you really need the support of other adults. But for both parents, in situations where there are two parents, in some situations we know are single-parent households, it is hard to sometimes use the other person for support because they too are going through the same crisis that you're going through, and you need to be able to kind of react to having a child with a brain tumor to figure out how you're going to cope with it, but also to figure out how you're going to acclimate to the knowledge base that you need to acclimate to know the different details of what medical care is, and then to figure out who's going to support whom and how. So one of the things that I have up on the screen, which kind of says family memories, is a concept that I have been thinking about for about 30 years, and it's part of why I think that some of the very special programs that you find in the pediatric oncology arena are very important for families, whether it is a WISH program, a camp program, a fishing trip. I mean, I think throughout the country there are all these different programs that you're able to access, and you think about, like, what does the diagnosis of brain tumor do? What does it change? Well, it changes in your household the track and the course that your family was on and the way in which your family created memories with each other, created time with each other. And if you think about kind of family life and what's integral to family life, you think about the things you remember of your own family when you were younger, growing up, the things you think back upon, or the things when you come together at family holidays, what you remember. You know, there's always like inside jokes in a family, and there's always the story of the trip when the car broke down, or the story of what happened when you stayed up all night, or what prank you pulled on who. Those things which seem very little are in many ways the fabric of what make up our memory base and some of what enables us to cope throughout life, knowing that we have a family community within our own immediate nuclear family who shares that network of memories. So why is this important? Well, because we all are the same emotional people that we were in many ways before the diagnosis happened, and we still need to have that connection to one another. And yet all of those things change. So I think throughout, from the beginning of the time when your child is diagnosed with a brain tumor, throughout the course of whatever their treatment regimen is, it becomes really important to try to find the time to create things that are memorable. Now, in some ways what happens is some of the hospital time and some of the time that families spend away from each other become the things that people start to remember. So if you think about a sibling, for instance, you have a couple of young kids in your family, their primary memories are of time with each other and of things that they are connected on, and then all of a sudden that changes and they start building separate memories, right? Maybe your other son goes and stays with your mother so that you can be in the hospital with your child with a brain tumor. Things start to change, and those memories start to change. So one of the interesting things is that in a very proactive way, it's really interesting to think about the ways in which you can continue to have family time and create family memories in the context of this illness. And in some ways also figure out ways in which you can have family fun in the context of this very, very difficult time. So I'll give you an example of this. We had one kid who, was in the hospital for Halloween. So rather than having separate Halloween experiences, everybody in the family decided that they would dress up in costume and that they would be in the hospital room that way. And so every time kind of a physician came in or a nurse came in, everybody was there and everybody was pretty silly. And it seemed like not such a big deal thing to do, but it is the kind of thing that years down the road everybody in the family remembers. So it's just interesting to think about kind of the things that are the components of emotional life of a family, what keeps people connected, what keeps people together, and also kind of what makes kids feel secure. I mean, sometimes what really makes a kid feel secure is knowing that at night a parent is going to be there with a bedtime story. So what happens if everybody's separated? Well, we live in a world of Skype and of email and of all different things where you can actually kind of create that time. You just need to be a little bit more creative to create it. So it's important to think about that in the context of living with a brain tumor. You're still living with a child, your children, and it's important for kids to be able to be seen as able to do things they can do. Now, I think of an interesting example. We had one kid who had major surgery 2 weeks before they were supposed to come to camp, and I have to tell you, if that child had been an adult, there is no way she would have gotten to camp. But she had in her mind that she was going to come out of surgery, she was going to do this, and sure enough, she did do it. And it was really interesting to see what sometimes also the desire to do something enables you to do. And kids really are more resilient than adults, and they really want to continue to be kids and to have the life that they have. So again, it's interesting to think about, like, we all know some of the stressors imposed on people, but if you think about it, like the stresses on parents, there are so many kind of caregiver stresses, I think, just with both having to take care of their child and having to maintain the other components of life, having to maintain their financial life, their work life. I think that parents talk all the time about not having certainly time for other adults or other adult activity or the kinds of things that maybe they were doing before a child gets sick. When you think about kids with brain tumors and the stresses they face and kind of the demands of things, there's a very long list, right, just in what you need to do to endure treatment. But if you think about, like, even the simple list, right, like even when you're not in the middle of treatment or not doing this or not doing that for your medical care, having the stamina to do things that other people in your family do is really hard, or having even the desire to do things. So it becomes like the interesting question of how do you enable people in your family to do things that help enable a family to be both hopeful and positive. I think I'm going to talk more about siblings as we get further along, but it's really interesting to think about all of the things that siblings feel. And I put here feeling disconnected, which is just among the long list of things. One of the things we have done, because we've always been a family-focused program, we've always had mothers, fathers, children with brain tumors, siblings, so we have a very natural environment in creating programs and also just enabling groups to happen for everybody. And we've really created a very, very proactive, I might even say activist group of siblings who feel a lot of things but are often in a complicated position to express what they're feeling because they may feel like there is no time, or they may feel guilty to even suggest that they have any negative feelings about the experience, but then you bring them to an environment where they get to talk to each other, and it is really very powerful to hear what happens. And I will read you some advice from siblings as we get a little bit further along. I put teachers on this list of things and stresses because I think that sometimes, I know there's been another webinar about going back to school, and I know there are a lot of things that have been written about kind of neurocognitive issues that children face, but there's also some very preliminary things. You know, you have a young teacher or a teacher who's just never had a child with a brain tumor before who is really frightened about having a child come back to the class and may not really be willing or able to say that that's the case, but may feel not capable herself in taking care of the situation, and how important it becomes for parents and professionals to keep everybody feeling calm and as though they are able and capable in the face of having kids with any of a number of issues come back. to the classroom. But that can get confused with people feeling like teachers are apathetic, or they don't want to be involved, or they don't want to be helpful, and it may come out of a different kind of emotion at all. And then the issue of friends is a really important issue for children with brain tumors, particularly kids who've had a cohort of friends before the diagnosis, so they're old enough to have a peer group and have friends that they're really connected to, because again, it's really hard to keep those relationships as strong as they were, and to also help kids understand what may be changes that the child with the brain tumor is facing. And we know how important friendships are, but there's already been a lot of discussion, I think, and evolving literature on the minimal number of friendships sometimes that kids with brain tumors have. And then I would just put other relatives, and we hear a lot about the challenges that families face with other family members and friends who they perceive either would be there for them and may not be there for them, or again, I think there are issues of sometimes it's hard to know what you're feeling yourself and what you're doing and what you're thinking about when you're kind of thrust into this, and I think that as an extension of that, it's hard for extended family members to also both understand and even know how to be supportive, and in some ways it requires families to be proactive about what they need from other families at a time when they're not feeling like they can be proactive about a lot. So I think everyone would agree that this is not a journey you would choose to be on, a club you would want to be a part of, and so once you're there, then you need to understand what your unique brain tumor journey is. And for some people, right, it will be a shorter, maybe it will be a journey that has a surgical intervention, and maybe that's all that will be needed, and things will regain a certain sense of normalcy. On the other end of the spectrum, though, there will be some people who will be in this for the long haul, for the marathon, that once this has happened, this will be forever in a part of their child's life, whether it is because of where the brain tumor was and different things that have become complicated as a result, or if it was in fact because there is a tumor that is inoperable and it will hopefully remain dormant for years and years and years to come, but it still engages the family in something that is much, much more of a marathon. And you think about how a family in their 20s will be different when they are a family in their 40s with a 25-year-old who is living with some of the challenges of a brain tumor. So it's almost like in a minute the caregiver roles change and family dynamics change. And there are many additional responsibilities, maybe for everybody, and people's roles shift, and then there becomes a time, and you know, again, it's not necessarily that people will sit down and say, hey, here are all of our new responsibilities, here are the things we're going to have to take care of, let's kind of apportion these things out and let's have a dialogue about it. I think it's very hard for people to sit as a family and have a conversation, and some of that has to do with time and stress and not having the language or knowing what to say, and some of it just has to do also with all the very different developmental ages of various family members and what people can understand, and I think it takes a long time to sort all of that out, and I think that there are very few families in which lengthy conversation is what happens, and sometimes I think what happens is that conversation happens in pieces over time. I also think that depending on what you have lived through in previous stresses in life, there are different coping styles of family members. You may not even know that you have different coping styles at times of stress because this may be the first stressor. So sometimes the rule of thumb, which is trying to figure out somewhat quickly who needs what from whom, who needs what to be taken care of, what are the new needs that are in the family as a result of the diagnosis. I think that it's important to always keep a developmental framework in mind, that one of the things when you are facing a child with a complicated illness is that it's easy sometimes to forget what they know and what they don't know and what they understand. So it's always helpful to think about the language that you use with a child. I put down my bow and arrow story because we had one sibling who was really upset. The sibling was set up to be the bone marrow donor for their sibling, and when you inquired a little bit more why the sibling was upset, it was because everybody's talking about this, and they say I'm going to be a bone marrow donor, but I can't be a bone marrow donor. I don't have a bow and arrow. You think in that child's world, the language that they could make sense of was a bow and arrow, not bone marrow. And so sometimes it's the simple things to kind of sit back and have a child explain to you what they understand so that you know that you're on the right track. I also think that some of the experiences that children find themselves in the middle are experiences that are hard for adults to understand, nonetheless for children to understand. So in the question of, like, how do you understand a brain tumor if you don't yet understand what a brain is? Children often know and understand more than the grown-ups around them perceive, and they tell us it all the time. I mean, sometimes I run a program where I will meet with kids in a kids talking group, and they will tell me things that they understand about their illness, about other people living with their illness, what's going on, and then I'll meet with parents who will be having a discussion of, should we tell our children this? And so sometimes it's important to let each party know what the other party is saying, and sometimes that intervention alone can make all the difference for a family. There are often misperceptions for children, and I think that sometimes when thinking maybe this is something I need to explain, that in fact it is often easier for children to understand things when they're explained to them by their own family members, as opposed to what they hear, what they make up, what they overhear, what they think, what they search on the internet. So age-appropriate information is one of the most effective ways to help a child cope. And another interesting thought is that, you know, if you're on this journey and you have a child who's diagnosed when they're 2 or 4 or 6, and then they become 6, 8, and 10, that the information both siblings and children with brain tumors get need to grow. So the information needs to grow older as the child grows older, which means kind of coming back to the discussion about what's going on a regular basis. It's always important to be aware of what you're saying in front of your children and what other people are saying in front of your children. You cannot control for all of that, but it is part of why it's helpful to be as honest as you can be, because, again, children will hear things. There's kind of intentional and non-intentional communication. We live in a world of caring-rich sites, social media, Facebook, and it's really interesting. Sometimes in an effort to cope, parents may decide that they're going to create a caring-rich site or a Facebook page, and they're going to use it kind of as a journal to say things. But one of the interesting things about using social media or something that is live is that once you put it out there, it is out there. So that if you have a child who's of an age where they use those other social media things too, they will see the things that are out there. But it's also true that your younger children will grow into older ages and will see things that you post now. So it's always important to think about not putting anything on social media that you don't want your child to know, but also I've had siblings say to me that they really felt concerned because they felt like their parents would post things before having a conversation with them, and that they would really appreciate that the information came to them first. Now, it sounds so simple, but I think sometimes it becomes then the routine in the household of who's posting what and doing what. There are things to be reminders, again, that kids are always kids, and that kids come first and their needs come first. In some locations, I know that there are groups running for kids. We have a series of programs and groups that run for kids during the course of the camp program, and I think that kids are very, very familiar with being in peer groups and being in school situations, so that it is actually easy for them to become part of a group, to engage in a group. And if you're at a center or a location where there isn't a kids group running, it's always a great thing to encourage people to start kids groups. Kids are really very happy to be both activity-based, but also to explain to the world or to other kids what they know about their illness, what's going on, what's happening to them. And groups really serve as a way of allowing kids to be connected in the world and to really normalize the situation. And one of the things that everybody faces when a child is diagnosed with a brain tumor, whether it is a parent, a sibling, or a child, is really the ability to be isolated. And groups really, again, fight against isolation, as do, I think, kind of camp programs and different kinds of activity-based programs. It's helpful to understand kind of how kids react, and again, the support and the fun that they can find, because kids by design are narcissistic and are thinking about themselves and their own needs, and it really helps them survive at times when there's a lot going on. So part of my thinking here is to say, when I talked to a number of families in anticipation of the webinar, I was asking for parent advice, and you'll see some of that. But I think there's a really strong message to say there's a lot of help out there, and sometimes it's hard to ask for help, or sometimes you don't know what the help is, but that there really are professionals who have an expertise in working with families of kids with brain tumors, and it becomes important to identify the social worker in your clinic, the child life specialist, the oncology nurses, psychologists, psychiatrists, neuropsych, people who can be there to help you understand what the impact and what is happening as a result of the brain tumor. I think that one of the things that I hope I would encourage everybody to do is, if you are a family of a child with a brain tumor and you have not met another family of a child with a brain tumor, talk to your center, look towards camp programs, and we have another weekend for families of kids with brain tumors happening the weekend of December 5th. That the value of connecting to somebody else in another family with a brain tumor is not just for support, but it's also for education, for knowledge, for connection, but to really learn what's out there in the world and to share that information. And it is, again, remarkable how people help each other and help each other to understand, what life can be like. We have a number of families who come to all different kinds of programs, either mixed diagnosis or oncology programs, and I always encourage brain tumor families, at least once, to come to a program for families of kids with brain tumors, because I feel like I have a secret, and it's like this secret world where, like, once you come into it, all of a sudden everybody understands you, but also everybody has ideas, and it is a way of taking sometimes something that seems so difficult and so abnormal and really making it so usual and so normal that it, again, changes the context of life, because we all thrive on that peer connection and also kind of the reality that kids with brain tumors can do a tremendous number of things. And I think sometimes that's harder to see if you're in it alone. There's also things to think about, like what happens. One mom said to me, that the best thing someone could have said to her was, if you had rules before, go back and use them now, because she had not allowed her child to watch TV before their brain tumor diagnosis, and then she felt like she let her child watch TV 18 hours a day, and that, in fact, in many ways, that gave a message to her child that things were really not the same and that she didn't have the same expectations, and he was seemingly very depressed, and she actually stopped allowing him to watch TV, and he started interacting again and engaging in the way that he had. Now, I think that it becomes important to think that children of all ages are not going to understand everything, but they need to understand things in accordance with their age, but it doesn't mean that the youngest of child needs to be in the room for every medical conversation. On the other hand, as children get older, they need to be in a position where they can assent to treatment, and then they can consent to treatment. It gets complicated in understanding what happens for some kids with brain tumors around cognition. It's important to always be sure to understand where your child is at and what they know. And I put a phrase here of age-appropriate honesty, and I think that it really makes sense to tell kids what they can understand, and also to allow kids to ask you questions, because they will ask questions to their tolerance of information. Sometimes we as adults want to tell kids everything that we know and that we're anxious about, and in a given situation. And sometimes if we allow them to ask the questions, they will ask us questions about the things that they want to know, and that is perfectly okay to say, I don't know, in answer to a question. So in thinking about siblings and how difficult the journey is for siblings, one of the best things that I have heard sibling after sibling say to me, which is just find other siblings to introduce your siblings to. And if you don't have a family of a child with a brain tumor in your community, if you do have families you're connected to that are going through other things, that there is a universal way that siblings often feel when their sibling is diagnosed And some of those things involve really feeling left out, feeling like they don't know what their role in the family is any longer, and that they still have the same need for individual attention or information sharing. I had one kid talking to me this summer, and again, it seems like it's a very simple thing, but she was 8 years old, and her brother was diagnosed with a brain tumor, and all of a sudden, she was going to school not with her mother, and she was like, but never in my life had I had that experience. And I think that it seems like a little loss, but it is for the child who's experiencing it a very big deal. So there are a lot of ways in which siblings, even a little bit of attention, creating an opportunity to do something with a sibling alone, allows them to feel stronger and more part of a situation. I think that when you see, it may sound very strong to say that siblings feel abandoned, but in fact I hear from siblings all the time how complicated it is for them, that they do understand that their other sibling needs their parents' attention, but that in fact they then feel guilty, feeling as though they want their parents' attention too, because they understand that it needs to be displaced for a period of time, but they worry about their sibling, they worry about themselves. The medical information can be really confusing, and you think about it that, like, as adults, there's a way to be in a lot of different medical meetings, and even the child with a brain tumor finds themselves with support services and in meetings and things, but that's not always true for the sibling, and there's a fair amount of anxiety associated with the whole process. And again, if your parents were the people you relied on for the greatest support, then all of a sudden when it's homework time or it's after school time, if there's a month that the prime focus is the child with a brain tumor in the hospital, then you really have to learn additional skills and to understand yourself a little bit differently as a sibling, and then to work on what that means for you in your relationship with your parents. One of the really interesting pieces of sibling advice that I have heard over and over again is that siblings are not necessarily going to go and seek their parents out to tell them what they need, because there is some feeling of, like, I'm the kid, I'm the sibling, my parents should come to me, or they should ask me how I'm doing, because they also don't want to impose or burden or get parents upset. I have a list of advice that siblings, I'm going to go through this very, very quickly, but this is from siblings of kids with brain tumors to their parents. And it was treat us a little bit more fairly. Don't just give everything to our sibling because they have a brain tumor. Don't yell. Life would be easier if you didn't yell. Have equal times with each kid so that the sibling feels equally important. Try not to be so protective. Trust the sibling. Allow them to be helpful. Don't care about my sister more than me. Appreciate us. Sometimes we feel unappreciated. When a sibling gets an injury, it could be just as important as the other sibling. And then maybe you think getting a flu shot for a sibling is no big deal, but because he's not used to getting shots, it's a big deal. And they're very innocent statements, but really kind of that sense of how siblings feel when they are on this journey. There's also some very unique worries for siblings, particularly in situations where a child with a brain tumor may have either significant cognitive impairment or limitations that will make that child unable to live independently or take care of themselves. I think that siblings really worry about their siblings. They worry about their parents' ability to take care of their siblings. They worry if, in fact, they will be in a position of needing to take care of their siblings. So there are a whole host of things that go on, particularly for older children, and I think not at the beginning of a diagnosis, but certainly down the road that it's important to think your children may be thinking of these things. So there are a lot of themes that emerge for children themselves with brain tumors, kids feeling out of sync with their peers. So it's also important to keep thinking of particular resources for the child with a brain tumor to be connected both to other kids with brain tumors, or to have the opportunity to go to a sleepaway camp or to go to any of a number of programs so that they can help feel the best that they can. I think that there are a lot of, again, losses that children may feel. And you think about some of it, you know, if you have been worried about your child's life, and they survive their surgery, their treatment, and they are doing great, but in fact they can't drive. That may seem like, oh, it's not such a big deal, but I think in the lives of kids becoming teenagers, becoming young adults, the things that make them different, the things that change their life in the future are all things that they need help with and understanding and dealing with and finding alternative opportunities. So again, for some kids, they will face the things that we understand about brain tumors, but then there's also kind of an anxiety that comes about recurrence, or for a child who's maybe been stable for a long time, and I think for parents and for siblings as well, that you just never know when the other shoe is going to drop. You know, though you're going to stay, many children live and thrive with a stable tumor in their head for years and years and years or forever, but there is, I think, a bit of an existential feeling of kind of living with the potential that this brain tumor could become active again, or it could create other issues. And I think that it takes a certain kind of thought process to think about how you live knowing that something can happen, but also still being able to both enjoy life and lead a productive life, and to think about what you need to think about as a person kind of growing up in the world. You know, in life, you don't need to have a million friends, but I think that it becomes important to think about what kids with brain tumors need as friends, and then the role of siblings as friends in the life of a child with a brain tumor, but then also the role of the friends of the siblings, and also siblings have talked about, you know, sometimes how they'll determine their friends is if they have a friend who has a problem with the fact that their sibling has a brain tumor, then they'll choose not to be friends. So on the friend issue, I think parents' friends, kids with brain tumors friends, siblings friends are all impacted in this. One of the things that we have learned is also that there's a way the world works in texting right now, and that actually for many kids with brain tumors, the ability to just text another kid or another friend with a brain tumor opens up a really wonderful and normal social experience in today's era. So between sometimes Facebook, sometimes certainly texting, that is an avenue for connection and friendship for a kid who may not be able to be out and about all the time, but can still stay connected to the world. There is a kind of sadness and loss that comes with the diagnosis of a brain tumor. It does not mean that it has to be the prevailing theme, but certainly it is there for people. I have some advice for parents, and I know we're going to move to questions soon, so I just want to quickly go through this, that when asked, parents were clear to say, find a doctor that you're comfortable with, to whom you can talk with easily. It will make all the other relationships easier to continue to live despite the challenges, and to find a peer group quickly, you know, because peer groups can help with big issues and small issues, and they can help prevent you from having to go through problems that maybe you don't have to go through. But to create somewhat of a mutual reliance system, that everything you need may not come from your family, but it may be there and available for other families of kids with brain tumors, because once you do enter this club, you really do want to help other people and be connected. And the good news is there are many people out there to be helpful. So to kind of enjoy the little things, to celebrate every triumph, to take nothing for granted. So there are a lot of resources out there, and you need to find people to help you learn about them and avail yourself of them. Hope is a very important factor in all of the relationships in the brain tumor journey. This is a photo of Camp Sunshine to entice you all to come. But it becomes important to hold on to hope and to reframe hope as you need it, to think about what you can do versus what you can't do, and to realize that for some kids they get stronger with each day, either post-surgery or post-treatment, and that every situation has in it with some degree of hope, and to use hope to remain realistic yet hopeful. We can talk about some of these things in the question and answers, but I just want to give you a sense of kind of the ability to remain, again, hopeful and wishing for things along your journey, and availing yourself of the resources of things that can be helpful. I realize we're at 3:49, so does that put us ready for questions and answers?
Thank you, Nancy. That's perfect. A lot of information to share. So we now will take questions. So if you have a question you'd like to ask, please type and submit it using the question box in the webinar control panel on the right-hand side of your screen. Nancy, if you just want to continue talking for just a couple of minutes, we don't have any questions yet, so if there's something you kind of sped through and you want to address right now, that's fine, and then I'll interrupt appropriately.
Well, I'd like to go back to siblings for a minute while we are seeing if there are other questions. One of the things that, as I said before, we have kind of this activist groups of siblings. Some of the things that I've really learned, again, in the misperception of facts and feelings for siblings, a lot of times they will say things like, well, we were never told the facts, or if somebody wants me to understand or wants me to not feel bad, why wouldn't they give me information? And I think some of that is, there's also sometimes kids are told facts and they just don't understand them. And sometimes they misinterpret the situation, thinking that it's something that it's not. And I think that they can misperceive their significance in a family. I think sometimes when you see your parents upset over what's going on with your sibling, and you too may be upset, that it's hard to imagine that anyone would care about you as much as they care about the person that they are so actively upset about. So sometimes it's just sitting back and really reiterating to other children that you really do care about them, and that if in fact it was them who were going through the situation, you would do the same thing. And then I think there is the concept of partnering with your other children too, because this is something that's happened not just to their sibling but to the whole family, and that sometimes you need to be partners in this together. And then, I mean, sometimes kids feel jealous, and then again they feel guilty at feeling jealous because they do understand, hey, you need to pay attention to my sibling, but they do feel like, but this was my basketball game, this was my birthday. I mean, I can't tell you the numbers of stories I have heard from children about their birthdays that have had to be redirected, even if it was 10 years ago. And I think it's because, again, birthdays and holidays are some of those things that kids hold on to and plan for and anticipate. And invariably, when you have a child with a brain tumor, things are going to happen. Those things are going to change, and there's no predicting that. And I think the inability to predict things also sometimes really sits with kids and can make the other children in the house very very anxious. And sometimes you'll even see kids like exhibiting anger. And there was one kid I was really surprised when he said to me, he was acting out in school because somebody had made fun of his sister, and his response was he wanted to make them as unhappy as his sister was. It was kind of, again, coming from a very painful place for this child, and he really needed help trying to figure out how he was going to cope and deal with the situation. So meanwhile, have any questions come in while we've continued to talk?
No questions as of yet, so we still have time, so you might as well keep sharing.
Okay. So one of the other themes that comes up for siblings is about loneliness and abandonment. And you think about those are strong words, right? But some of it is kind of on a physical sense, an emotional sense, and even an existential sense, because sometimes kids really just feel left, whether they were, a plan could have been very, very thoughtfully made for them to be with a grandparent or to be with a friend, but their own physical sense could feel as though they're left out, or they're not brought, or they're not part of it. And one of the interesting things is to bring kids to the hospital experience and to the hospital when the child is hospitalized, or to clinic, both because it allows them to feel part of it, but it also allows them to recognize that it's not necessarily such a special adventure or such a wonderful thing, and it allows kids to then have the ability to make the choice of whether they would go back. Again, I also think that I know that I've used the word what the existential experience is, but if you think about it, I mean, some of the biggest issues that everybody deals with in life is trying to understand life and trying to understand all the different complicated circumstances in life. And I think sometimes for kids, when they're left alone without their parents, they really do have this very unusual sense of being disconnected from the previous family experience they knew. And some kids are more resilient in adapting to that, and some kids will find themselves very scared and very sad. And again, if you have a situation where you have a kid who is sad or scared but not willing to tell you, you're in a very, very complicated situation. And sometimes you don't know until something comes back from school or something happens. And sometimes kids are not so forthcoming in school, so it becomes really important for parents to be able to engage teachers and guidance counselors at school and what's going on, so that everybody's on the same page. Because sometimes the expectation of a sibling is really complicated. Say a kid has a final exam and it's the day that their sibling is having their second surgery. Well, sometimes people don't want to say, well, gee, I can't take this test, but sometimes it really has an impact on them. So you think about like the theory that you could be having everything change dramatically in one child's world, and in the other child's world it's supposed to be life as usual. And the reality is that it's not life as usual. And I think that we all work as professionals to try to maintain a normal balance and to keep kids' lives as as connected to the life they knew before as it could be. But the reality is that the life is not the same, and that just even the ability to concentrate sometimes for a kid is not the same. So some families have taken to, when they create an IEP or an educational plan for their child with a brain tumor, they actually include the sibling in that plan, so that it's true that the school and the school counselor will pay attention to the sibling. So I think there's a lot of things that go on for kids in that venue.
We do have a question, Nancy.
Okay.
I have a grandparent on the webinar, and she has a granddaughter diagnosed with a low-grade astrocytoma. She says that the parents seem to be handling this better than I am, and at some point I am concerned that they are in denial of the potential outcome. I continue to struggle with worries and questions of what if. Are there helps out there for grandparents or parents to help them deal with this type of stress?
So that's a great and common grandparent feeling. I think that like grandparents feel the pain of what's happening for their grandchildren and also the pain of what's happening for their children. So they have kind of a double whammy in what's going on for them. I think that sometimes, well, so the answer to, are there resources out there? I think that there are resources. I think many of the different brain tumor organizations have information up on websites, both about caregivers and sometimes about extended family. I can tell you, in programs like ours, we always encourage a parent to bring a support person. So sometimes both parents can't come, but we will have grandparents at the program. I think that sometimes the ways in which you can be helpful as a grandparent are to help people find resources. So like when you say to me somebody has a diagnosis of a low-grade astrocytoma, I can actually say to you, well, we have a session for families with low-grade tumors, and that becomes, again, a tremendous resource. And depending on how much for the grandparents they are in the information of what's happening, it also may be that they are at a disadvantage in their own coping because they don't know everything that's happening, and they don't know kind of the new advances and things that are happening. There are a lot of things happening now in the low-grade astrocytoma world with new kinds of research developments and some things that are like new that have not been new in years past. So this is actually a really important time in the development of kind of research and treatment for that particular kind of tumor. So I think that within the resources that are out there, there are ways and avenues for grandparents, but also kind of opening the dialogue and letting your children know that you want to be helpful. And it's interesting. Sometimes when people worry that people are not reacting because they're not sad or they're not coping, it may in fact be that people are making a choice to know everything that's going on, but also to be acting in a particular way for themselves and for their families. And sometimes that really helps people cope. So I think that having everybody on the same page and how they're feeling at the same time doesn't always work, but that might really be okay, because if everybody was depressed at the same moment, if everybody was reactive at the same moment, maybe a lot of things wouldn't get done. So maybe it's really okay to be in different places, but to work towards opening the dialogue of communication so that people know that both this is hard for you and that you're there to help.
Great, thank you. That was perfect timing. So we're right at the 3 o'clock point. I want to really thank you for joining us as the participants and Nancy for the presentation. And let's just pause for just a moment and we will conclude our webinar recording.